So why does my OB not really test for my testosterone levels? Because when I came here, my levels were like crazy, but I had recently gotten my levels checked, and they were just like, oh yeah, thyroid's good.
We're really not taught about that in medical school. We're taught what the hormones are, but we really aren't taught any kind of hormonal management or optimization. And, they just don't look for it. We look for it because we specialize in hormonal, replacements, hormonal optimizations. And somebody that presented the way you presented, because another thing is we listen to you. And when we're hearing about this lack of energy and lack of focus and lack of libido or decreased libido, all these things are consistent with low testosterone levels, the inability to lose fat. And we did your levels, and they came back surprisingly low, especially for somebody your age.
Yeah. I wasn't surprised, but I was surprised. I was like, oh, wow. Okay. Well, yeah, this makes sense.
Yeah. So the biggest thing is we're looking for it when we suspect it, and you presented with all the symptoms of somebody with low testosterone.
Taylor was telling me about incontinence and how you actually have treatments for that, which I had never heard of. I have heard of pelvic floor therapy and all of that, but how do you know if you're a candidate for that?
Well, first of all, you had a vaginal delivery.
Yeah.
Right? Okay. When a woman gets around 40, any woman who's had a vaginal delivery is pretty much always going to have some kind of stress incontinence. That's where they leak and when they cough, sneeze, laugh. The statistics might say that number is really only around 50%. The answer is really it's much higher than that. So many women don't even consider it to be a problem because their mother leaked, their sister leaks, their friends leak, and so they just consider that's just part of being a woman. It doesn't have to be. As a urologist, I would do surgeries that were pretty intense and took quite a while to recovery from.
Yeah.
But today we're able to take your body's own growth factors from your platelets, platelet-rich plasma, and place it back in the areas that support the urethra, which is around the G-spot, and it gives just enough support where the vast majority of women that we see are, if they're not completely cured from their incontinence, they are dramatically improved. Wow. And, and it's natural. What's the risk? A bruise, because it's your body's own healing factors. And, that's revolutionary because I would have done a third to a half the number of surgical procedures that I did as a urologist when I operated. And then we have the benefit of what it does for the intimacy part. We'll oftentimes put the platelet-rich plasma also into the clitoris, which is not part of helping with incontinence, but it helps a lot with intimacy and orgasm improvement. And a lot of women don't tell their providers that orgasms are a problem, and we can do a lot to help enhance that. Also, the hormone therapy definitely helps along that aspect.